we are going to talk about the radial nerve. And so just to give a better sense, so again, median nerve, kind of straightforward through here. The radial nerve, what we're going to do just to illustrate it is going to be a little different setup. And so when you have radial nerve symptoms, you tend to feel them more through your pointer finger, through your thumb, and there's more of a rotation component that happens. Another test to see if you're having more neural symptoms because of the radial nerve. So what you would do is, again, kind of make sure you're depressed through the shoulder. That, again, tensions through the neck and through the brachial plexus. And then you're going to turn the palm down and then bring the palm up. So when you do that, and I'll show you from here too, when you do that, and then you can also add another neck component, but honestly, if you're sensitive enough, even just getting into this position is like ding, 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 yeah, that's where it's at. And if that's the case, you don't need to add all of the rest of the components. We know that's where it's at for you. Then you can work in some gliding into this pattern. So getting some very gentle rotation to try to get that nerve to glide and to slide. So again, to, tension it, you can turn it maximally at the wrist and then take your neck away from the side that you're working on, or to glide it, right? When you turn, you take your neck with you, and then when you turn out, you take your neck away. So that would be a slider or a glider. Finally, we're going to talk about the ulnar nerve, which is when you hit your funny bone, you're actually hitting your ulnar nerve. And that's because the ulnar nerve travels really superficially, just on the inside of the elbow. And so if you hit it, it really doesn't take much to send you a zinger. That's pretty strong. So for that one, you're going to get more distribution of those symptoms in the ring finger and the pinky finger. So that's where I'm going to put this here. And then again, I just kind of, where it goes is, again, right on the inside of the elbow. So that's kind of where I'm going to show you. And then what you can do to kind of test for this is, I always say, make the A-OK sign and then try to look through your finger. So when you do that, you're kind of tensioning down through the elbow and then turning the wrist in a way where you're stretching that ulnar nerve. And if you feel it in these two fingers, then that's a good indication that you have more of an ulnar nerve issue. Same deal, honestly, again, you literally just use a variation of that movement to be the treatment. So you can, so when you go like this, you're putting a lot of tension through there. So what you can do for this one is to put more tension through. So you can kind of turn the wrist, doesn't have to be through here, but something similar, and you are, with the head away, you're tensioning, and then with the head towards, you're gliding and sliding. Okay, so if you have any symptoms of nerve pain through, the shoulder, even through the neck, because sometimes it's coming from the neck and it's not necessarily coming from the carpal tunnel or more of the peripheral nerves. That's why a good assessment is actually very important, so that you're not treating something where it hurts, and not at the actual cause of the issue. You don't know how many people I've seen that have gotten treated for carpal tunnel, and it wasn't coming from here, it was coming from here. So it's good to know why you're having pain or where it's coming from. That way you can really specify what you need to do to help yourself. So if you need any help with that, let me know. Let me know how you guys like it. In general, gliding and sliding the nerves, especially if we're, just sitting with rounded shoulders a lot of the time, it just feels good, like you just kind of need to do it. So it's even good just to work in your general mobility every day. Check you guys next time.